As the age of onset of type 2 diabetes is rapidly coming down in India, we are treating more and more girls who are in their late teens or 20s with diabetes already. Now, when such a woman plans pregnancy, it's an issue because you're 28 years old, you want to plan your first child, and actually you already have had diabetes for 5 or 6 years. What should they do actually to make sure that they go through pregnancy uneventfully and safely? The first thing is that for every diabetic, pregnancy has to be planned. A woman with diabetes should not randomly discover, ideally, that she is pregnant. She should visit her doctor at least 3 months before she is actually planning a pregnancy. During this period, you have to make sure, A, you have a check for all complications of diabetes. You get your retina checked, get your kidney checked, number one. Number two, you make sure that your HbA1c, which is an integrated value of 3 months of diabetic control, is actually somewhere around 6. At the time of conception, the A1C should be as close to normal as possible, maybe around 6, as I said. It's also important that if you're overweight in that period, try and start losing some weight, because if you start pregnancy, when you're already overweight, you'll probably put on a lot of weight and you're much more likely to get diabetes, worsening of diabetes in pregnancy. The drugs that are used to treat diabetes are also different in pregnancy, and therefore it may be advisable when you are in the fertile period, when you have decided that yes, you have to go ahead and the doctor has given you the green signal, in that period you should only be on drugs that are safe. So for example, the main drugs that are used for diabetes in pregnancy or for those planning to become pregnant are insulin and metformin. And often other drugs will have to be discontinued. So the message here is, make sure you plan your pregnancy properly. Even if you have diabetes, a natural healthy pregnancy is possible, provided you take all necessary precautions.